Hi guys. I was at the eye doctor and he looked into it. My eyes are from his perspective fine, but he said it's a brain thing that's causing all the issues that I'm still having, which is logical. It's my dog. Stop it. You're crazy. Um, and it's because it's putting pressure. The lesion is swollen and the nerve is swollen, so it's putting pressure on my eye and causing me to see things that are not there, which is just a little bit, thinking about it, I don't know, just looking also into people with all the mental health issues and of course with the MS, so many people die because they commit suicide. It sounds hard and tough, but I do understand that because you just lose reality and the amount of pain that is just caused by it as well. The nerve pain, it's so much worse than you have an open leg and everybody sees it, everybody understands your pain. This is something nobody understands, the pain, because it's your nerve system that's causing the pain. So I do get the point where people are just going bananas and just do stuff they probably won't do if they just receive the right amount of help. So talking right now, I had a video call with Chaffee, with Anthony, Dr. Chaffee, and I'm a part of the study group that they're creating for the MS, and it's gonna be like the first study group in that direction who's gonna present some results. So I delivered all my medical records, all of them, and yesterday just spending almost 12 hours to digitalize all my medical records made me realize something that is just shocking. It's shocking. When 2019, when it started, and I just looked in all the blood works, in all the papers from the hospital, from the neurologist, and so on and so on, and my family doctor and all the other doctors and everything they checked out. They only checked these things out that I have because I did it privately and I paid for it because they just were pushing it into another direction. And I was lucky because one of my friends at the time is an eye surgeon, and she walked me through these things and said, check for Lyme disease, check for your B levels, check your vitamins, check this, check that, because most of the symptoms which come from the MS can also be caused by too much vitamins, too much of certain kind of supplements, which I also had at some point of my medical history. So the most important thing is that my B12, when I tested it, was in the reference range. And I just talked with Anthony about it because it was 200 something, and I think 150 is the mark in the lab that was taken by it, which is insane. It is insane if you just think about it, that your B12 can be that low. This is crazy. And that the MS clinics are not aware of how high your B12 should be, at least, especially when you have symptoms, to just check that out. And that's a little bit of the issue. And it should be 1,200, something around that. And it is way too high from the reference range. And that's also something that I ask, how can you change that as in a medical field? Because now basically everything also that I research is pointing to that direction: high vitamin D, high B12, and the B complex, all the other B vitamins should be considered, in a good variation, especially vitamin C as well then. So you have a very complex mix of vitamins, which you should be really aware of. It's not enough to just take B12, oh, it's fine, because your other B vitamins can drop and the body will just, do stupid stuff with it, just say it like that, if you don't use the right amount of all the vitamins to even that out, that you take higher vitamin D and higher vitamin B12. And that's something that is so important because I see it in my blood work. It's important and crucial to know these stuff. And it's not easy to understand that, even for the medical people, because they are educated in especially these kind of fields. For example, the Coimbra protocol is the high vitamin D protocol with MS patients, also other autoimmune issues, but there are only few doctors who offer this kind of protocol because they're educated in what you should do and how you should do it. Especially with the high vitamin D, you shouldn't use dairy because it can cause your kidneys to fail, and it's too much for a normal person. It's even, if it's for a doctor a lot to be specialized in these kind of things, it's too much for a normal person to get yourself into that, to understand the complexity of these things, because it's just very controversial and everybody's saying different stuff. So how can you know? But just looking into all my medical history, it's very obvious that every time that I had a relapse from my MS with all the symptoms showing up, my B12 was under 300. So maybe in the end, that would have fixed me. I maybe wouldn't have any symptoms if I just had to get to the point where I have a higher vitamin B12, but something that I didn't know. And just right now I know, even with all the research and all the people that I'm talking to and all the doctors, even in the carnivore world, is that it's not enough to take the high B12. It's very important to take also all the other B vitamins to keep them even, because it can go the completely other direction as well. And then you're harming your body in the end if you don't have everything you need. And with the vitamin D, higher vitamin D, to take that with dairy, I also wasn't aware of that, because I was just, okay, take higher vitamin D, it's fine. I also could harm my body with my kidneys to fail, and also the vitamin C part. So it's just a lot. And the vitamin K then, and you see where I'm going with this. So it's not easy, and to find a doctor that knows that you have to have a higher B12 than the reference ranges, it's almost impossible. Like I said, only this summer I was at 40 doctors and none of them had knowledge about that. They were all just looking at my vitamin D and high B12, and it was like, oh, okay, fine. They didn't even say, it's high and it's fine, but let's check then all your other vitamins if they're even, just to be sure. It's just a little bit crazy, I think. So that's from the blood part. And the other thing that I discovered looking into all of my medical records, it's insanity. It is, because my history shows with one of my last seizures that I took the medication at that time. It was Copaxone, so it's an injection that I have to take every day. And I told my doctor, and you see it in all, they're writing everything that I'm saying, so I have everything that I told them in writing. And I saw that I told them, my skin where I put the injection in is getting numb. And he said it has nothing to do with the medication and the injection. And I say it doesn't make sense, because I didn't have that before. It just started when I'm injecting it. It's getting numb and it stays like this. And he said, no, it's not a side effect of the medication. It's impossible. And I said, okay, and then I took it over and over. And every time I had to put the injection somewhere else. And I said, this feeling of numbness is spreading all over my body where I put the injections. It's like having this little ring over my whole stomach, because that's where I most put it. And he still said it has nothing to do with it. I mean, that's crazy. It's crazy. And he said, no, you have another MS episode, relapse. We have to give you cortisone. And we took the cortisone and it didn't work. You know why? Because the damn medication was obviously, and just looking at the medical records, everyone with just, a brain will see that this is stupidity. And this is just shocking. And he's the leading MS clinical doctor here in the country. So he's not just somebody, he's like somebody. And it just shocked me. It really shocks me. And the same thing then when I changed my neurologist in the MS clinic, I see her records as well. And we changed then to another medical, to Zeposia, which is in a category 2. So it's a stronger medication for the MS. And the same thing happened again. That was short before a couple of days that I went on carnivore, because the same thing happened again. They were like, no, all the side effect doesn't come from the medication. But as soon as I stop the medication, all the things go away. Ooh, don't you see the relation maybe? Just almost 3-4 days later, everything disappeared, especially with the numbness of the skin that disappeared because the cortisone didn't help. And they said, yeah, it's the cortisone that helped. I said, no, I still took over a month or something like that. I still took the medication. My numbness was there even after the cortisone. Then I stopped taking these injections just all by myself because I said, fuck it. And then it stopped. So don't you see it? No, you're wrong. Okay, fine. The same thing happened with Saposia then in the category 2. So this is when everything just backfired and they say, we're gonna go to category 3 because you're just gonna die. And there is no way, because if this doesn't work, nothing's gonna work because you have all the antibodies for all the other medication that there is out there. So great, let's go there. And that's the moment when I said, just no, no, I'm not gonna do this again. And then I did carnivore and I got better over the 6 months period, in first 6 months. And then now the lesions showing that the first time they don't grow like they usually grow. And it's also that I said to Anthony, because you know what they said to me, the neurologist, when I told them that and they saw that, they said, yeah, it's because you took the medication months ago, that's why they're still working. I said, no, it's not true. It doesn't make sense because they didn't work before. Why should they work now? So me just having these effects, which you can see black and white, how can you not see it, that it has to do with one major thing that I did now in my life, and it's just only one thing. I changed my diet and I'm just eating more meat. That's it. So how can you not see that I made a major change in my diet, and then suddenly my pictures in these 6 months, because I have a picture in the beginning and in the end of these 6 months, are showing some kind of results? She said, no, you're wrong. It's from the medication and still working. I said, okay, great. That's also what I said, to in the studies that they're doing, to just put it also in the study, what is the medication, how long does it work actually in the body, just to put it out there also from the medical perspective, because it just doesn't make sense. It doesn't. So for me it's important, because now having this optical nerve issue, so they say it's another big lesion but nothing else changed. So it's just that, and also this red cut cyst is showing up, but it's growing very in small portions, so it's millimeters. But I did my research again, and there are some hospitals in Switzerland and America that show some correlation with the optic nerve system and the red cut cyst, even if it's that small, like in millimeters. It doesn't have to be big because it's still having the impact, and they just do the surgery when it's too late. So the only thing that I can do right now is just doing a lot of MRIs again, which is also not good for the body, but to have the pictures and see if, when my eye problems just getting worse, if this cyst is growing at the same time, and then to make the relation between it, and then to say, what, can we please look into that? And then pay a ton of money to go to Switzerland, like 10,000 of euros to go to Switzerland, maybe to talk to people who are educated, especially in that field, or in America as well. But Switzerland is much closer. So these are the options that people have, and especially when they can't even access to the private medication, it's like impossible to get even an appointment. My doctor's appointment, which I don't have to pay private, would have appointments in 6 months. In 6 months, all of them. I don't know what's happening. 6 months. I said, I have a really emergency. You can't even call them. So the same thing happened also with the skin doctors, like dermatologists, because when I had to do an appointment for the MS medical things, they said they can't offer any appointments, and they have just a block all over the country because they're just not having enough dermatologists anymore to cover all the needs that people having. So, and also talked to a friend of mine where they found blood in their stool, and she was like, oh my God, we need to do something about it. And they say, yeah, you can wait 3 months for an appointment to check that out further. She said, I can't wait 3 months. What if I die? What is happening? And then she thankfully had enough money to pay privately for doctors to check it out, and look at that, she had to have a cancer treatment in the end. So, you know, all these things are really horrifying to think about it. And I think if you have no reason to work hard and make money, I think that would be a pretty good reason. If anybody, you or your family members or whoever got sick, that you just have enough money to pay a private doctor, even that would be a motivation enough. It's just sad. It's really sad. So for me, it's important to go as much lion as I can, but it's not easy. As I said, I have issues with, I had prior eating disorders, so it's hard for me, especially from my mental health. The stricter I go, the more mental ill I get. So, and it backfires most of the time. So that's why I need first to fix my brain, and that's how easy it is. Then just to force myself into a diet, I need to make it good for me. Right now I'm just craving meat like crazy, but there are most of the time just when it's a little bit more difficult, and I want to eat now 1 meal a day, but there are times where I just want to eat the whole day, like every 5 minutes. It's very difficult to keep up with my own body and my brain. So this is why I'm seeking, you know, help with some specialists for just to seek into my mental health. I wanted to go to my hypnotherapist, but she is having her own battles, so I needed to find somebody else. And it's really hard to admit that you just need help, especially when it comes to a psychiatrist and psychologist and so on, because they're taking a lot of money, you know, and just even having them private, but also having them paid by the government, by the health insurance. The amount of recommendations and what people wrote is crazy. It's really bad. It's like, oh, they're treating me like hell. My conditions got even worse because they were so awful, and so on and so on. So I was like, you know, that's bad. You don't want to do that, but that's your only option if you cannot access it privately. And again, this is a money question thing for private doctors in the end, just to experiment and find people who can help. It's just sad. It is. Yeah, but as I said, I know a lot of doctors who also work for health insurance things, and they said they have 2 minutes per patient. That's what they get. So they want to help, but that's the only thing they can do. And that's the major problems we are just facing. So yeah, but I'm babbling. So I just want to say, everybody who's, because I know most of the people who watch my videos are from America, so if you're near California, as my roomie Angie is having her home there, she just sent me a video what's going on, and yeah, unfortunately all the videos seem to be true and are not fake, and you know, it's like really even worse than most of the videos I saw on Instagram. So it's terrifying. I hope you're safe. I hope you didn't lose your homes if you are from California. Yeah, I wish you the best, and we're all praying for you guys. And yeah, so see you soon.